Hi, everybody. I am excited to have Jen Uschold with me today. And I have been looking forward to this conversation because for many years, I have to tell you, I always said, and this was something that I felt like a badge of honor. I am not very good with pain. And really, the whole concept of pain has intrigued me for many years. And obviously, my thoughts and approach to pain have definitely changed. But Jen grew up in Western New York and has been a PT for over 3 decades. She has worked in multiple treatments environments, including travel PT. And out of her love for PT and helping others to empower themselves, she was drawn to both pain science and health coaching. She has completed a fellowship in pain science with evidence in motion. Jen is an eager learner and has also studied lifestyle medicine and positive intelligence, which you know I love. Jen loves to have been teaching since 1998 and in companies in Chicago, Virginia, Colorado, and internationally. Jen has owned a small private practice since 2007. And outside of PT and coaching, Jen is passionate mom to three mostly grown kids while seeking laughter and connection with others. As the saying goes, laughter is a good medicine, and Jen wholeheartedly agrees with that. So we're happy to connect with her and talk about everything smiles, laughter, pain, and her journey. So, welcome to the show.
Thank you so much. I'm happy to be here.
I am excited to have you. And one of the things that I wanted to do is I have been obsessed with Stephen Bartlett, who is the host of Diary of a CEO podcast. And he has these incredible questions that he asks people. So I have gotten a hold of the questions. And these are the questions that his famous guests ask each other. So now you get to get a question. So I'm going to randomly pick, and I don't
Okay.
even know what this one says, but let's say. So this is a question that actually was asked. Macklemore wrote this question for the next guest. So
Okay.
if you would go back to one era in civilization, what era would you pick? And why would you be good at your job in that era?
Well, this is such a cool question.
Yeah, right? Like, I love that.
I think this sounds so bizarre, but I think I might actually go back to the caveman age because everything was about curiosity and learning. And
Ooh.
honestly, when I eat a fruit or a vegetable or a grain, how did somebody figure out that this was going to help us and not kill us? And those were the people that kind of paved that road for us. So I think
Yes.
that is where I'd like to go. And you know what? We don't have iPhones. People don't hate each other as much. So I think that's where it goes. So I can really tap into my crazy curiosity.
Well, curiosity is such a good skill to continue to foster and have. And I think that a lot of people kind of get away from that. And so I'm so glad that you mentioned that. What is another area that you use curiosity in your life?
I am curious everywhere. Sometimes I need to rein in my curiosity. I had a friend once and we were in Maine and I was just asking her questions because I'm very curious. She's like, Jen, I just can't take any more questions. So I was like, okay.
Oh,
so, so I'm finding that balance point. I am very curious with my clients. I am very curious with my kids. I like to be curious about trying new things. And I was on a walk and we saw some really weird ice formation the other day. So I have two siblings who live in cold areas. And so I was like, hey, what is this? This turned into a Facebook post, finding pictures from previous trips. So it's really fascinating to just learn and see what more our world has to offer. I truly am of that belief that learning is never done. And I love the phrase, let's start with curiosity and not criticism.
thank you so much for saying that. I think that there's a lot in the world right now that we're so quick to jump into criticizing or taking the opposite view. But I do believe curiosity in uncomfortable situations, especially, is a really great gift. I know that at times, well, it's normal for us when we encounter something that is different from us or unknown, we are going to be very hesitant or defensive about it. But I think that finding curiosity, why do they believe that? Why is that happening? It's always something that is really important and has helped me navigate so many different things in life. And I know that for me, curiosity comes is a gift because I love interviewing people and always asking questions.
Yes, exactly. You have a great job. Yeah. And that curiosity also helps us to become empathic to the other person's situation. Because whether I'm teaching pain science or lifestyle medicine or the mental fitness, what we know, what you and I know of each other is barely a blip on the radar. And I describe it in the lifestyle medicine courses that I teach as if there is a beacon of light going out behind me, which is every experience I've had in my life and generations back, and the same for you. And all of those things are influencing our interaction in this moment. And I think that's an important consideration because we have no idea where that other person is coming from. We can choose an interaction to enhance the communication or shut it down.
Yeah, absolutely. And I think that this is something that I am hoping that through the work that I do and other coaches like you, we can continue to create this ripple effect in the lives of others. And it's so needed. And I love when I met you that you're also a mental fitness coach because I feel like we're speaking the same language in so many different ways.
Exactly. And it's when people can hear something similar, it builds that in their mind versus I was just talking with somebody else about this earlier today. When it comes to people who experience chronic pain, when they are able to get similar messaging from their providers and from other people that have gone through the experience, this helps them move forward in their situation. We actually have research by a physician, Dr. Richard Deo, that shows the more tests and scans and appointments we have and different opinions actually can increase our experience of pain. So, common language, common connection can help reduce pain.
Thank you so much for mentioning that. I think that I am a big proponent of, again, curiosity, right? I have become the best advocate for myself when I am going through something medical. I never stop at that one answer from one provider. I ask, and of course, I go to Dr. Google, but I really do ask for second opinion from doctors. I have a friend who's a physician. She specializes in palliative care, so she's done a lot in different areas. And I love to really be able to be informed, but mostly because I think that when there's true understanding, then it helps you navigate whatever circumstance is there. Or again, going through it with that childlike wonder in saying, well, what am I going to learn and what can I do different, right, as I continue to show up?
You are absolutely correct. And I love how you say that awareness. Um, Pain neuroscience education is an approach that I use very much when I'm working with people with chronic pain. And it is no longer a question of does it work? The question now is what is the best way to apply this and integrate this to other treatments and other interventions. And so the very base framework is pain neuroscience education. So
Mm,
we know that educating people about pain actually can reduce their pain. How do we know this? Because we have fMRI studies. That is a fancy name for a brain scan that's in real time. And I even show my clients, I have a picture of someone resting in a scanner, nothing going on with the brain. Ask them to do a movement that they know is painful. Their brain just completely lights up. And then all they do is a 20-minute session on understanding pain. And the scan is so much quieter.
mm.
Doesn't negate all of the other things that we have options to choose and utilize. However, it does demonstrate the power of education. And the same is true with mental fitness and positive intelligence. The very first muscle we talk about is intercepting the saboteurs or becoming aware of your negative thoughts and emotions because you can't change them if you aren't first aware.
Mm, so good. So I want to go back and take a step back because I love everything that you just shared and I want to come back to it. But first, so someone is just tuning in. What is pain science? Tell me a little bit more about that.
Yes, so good that you asked that question. So, pain science is the study of pain. And we are so fortunate to live when we do because our knowledge of pain has exploded since the 90s. And that is because we now have PET scans and CTs and MRIs and these very, very fancy scans that help us understand that pain is an output of the brain. Prior to that, for 3.5 centuries, we were working on the model from Rene Descartes, who said pain is either physical or psychological. We now know that all pain has both a physical and an emotional component. And so that is what pain science is understanding pain. And the two groups, people that have had RSD is the older term, reflex
Mhm.
sympathetic dystrophy, and the newer term is CRPS, complex regional pain syndrome. Hear that as so much pain. And also, people have had amputations, people that could still feel that limb.
Mm.
We used to tell them they were crazy. Well, they are not
They are
crazy.
not crazy.
Body representation is still in their brain. And so that is what pain science is let's use what we have available to us, dive deep and learn about the complexity of pain so we can help people in pain.
I thank you for mentioning that. Was very close to my maternal grandmother. When I was 5, she had a diagnosis of a very rare cancer. We lived in El Salvador at the time. I remember she actually flew to Houston to get the diagnosis and treatment, and they said that it was probably not going to be a great outcome for her and they
Mhm.
needed to amputate her leg. So she went to Mexico and went to visit the Lady of Guadalupe and was very faith filled. She was in a lot of pain at the time because she had her tumor was in the leg and she could barely walk. But she really took that pilgrimage because she was framing herself for this surgery that was to come. And by the way, I know the story because she would talk about it a lot even after I was 5 and I was very close to my grandmother. Um, when she came back to El Salvador, she had her leg amputated and she was in a coma for several weeks and they didn't think she would survive. She not only survived, but she thrived. But I do believe that the thriving came from her creating this mindset, this unbreakable way in which she was not going to be defeated by her circumstances. She was always going to try to find the gift in whatever was going on in her life. I saw her, and I talk about it in my book, in which she willed herself to continue to walk at the time. I mean, she was in her 70s and she had a prosthesis that weighed 100 pounds and was made of solid wood. She taught herself to walk with that. And I remember seeing her just be so tenacious in her experience. A lot of times when I have gone through circumstances that are painful, especially physically, and I'm sick or something has happened to me, I go back and I remember, if she could handle that, I could handle this and really try to remember. But one thing why I bring up the story is she used to suffer intense, intense pain from what she called her phantom leg.
Mhm.
And there were times in which, a lot of the pain was stuff that she managed. But when the pain of the phantom leg would come, and a lot of people didn't understand that. Tell me a little bit more about that because I'd love to kind of deep dive into this and learn more specifically because I experienced it as a child.
I love that story. And I hope that your listeners are listening to the empowerment and mindset part of your
Mhm.
grandmother and how that allowed her to function and thrive for so long. That is just such a fantastic story. And in terms of the phantom pain, people do have pain in those limbs that have been removed. People have an itch. Imagine an insane itch in the limb that doesn't
Mm,
exist. So,
yes.
why does that happen? So, I'm going to start with a little story about how pain works, and then we'll dive into the next piece of it. So, my first question for you is if you stepped on a rusty nail, would you want to know that you stepped on a rusty nail?
Possibly because I wouldn't want to have an infection from the rusty nail.
Okay. And how is it that you know you've stepped on a rusty nail?
It's you have to be aware in the moment, but sometimes we're not aware that we've done these things. And
Hmm.
it's not until the I guess the infection or whatever starts to happen. And from my perspective, if I step in a rusty nail and then there's a wound, my brain is going to send blood cells to kind of start to heal that. But as you know, there's like I think of it as a little battle between the infection and my body fighting. And that's a little bit of what's saying, hey, danger, there's something happening down here. Pay attention to it. And I don't know if I'm way off base or kind of there, but I think that it depends on where you are. There's times in which I've hurt myself and I don't realize it till later on.
Thank you. It is almost as if we planned this and we did not
We
plan
did
this.
not plan this, did we? Okay.
But that is such a great introduction to how pain works. We
Mhm.
do not have pain sensors and we do not have pain nerves. So when you step on this rusty nail, it goes on to what we call a danger neuron. So you already used the word danger. The fancy word is nociceptor. So it hops on that neuron and then it goes to the spinal cord, hops on another neuron, then it goes to the brain, and the brain says, danger, we have stepped on a nail. We need to let ourselves know. And so then you will feel pain. Also, to your point, if you are walking in your driveway and you step on that rusty nail, we definitely want you to feel that. However, if you are running away from a rabid dog, there is no value in you feeling that nail. So your
Mhm.
brain is constantly evaluating literally billions of pieces of information to determine what is the best way to keep you safe. So when you're running from the rabid dog, no, we are not going to feel pain, quite likely, because the bigger
Mhm.
threat is the dog. Once you're safe and away from the dog, then you will likely feel the pain in your foot. So then you can take care of it. So all of these things tie in additionally to our the structure of our nervous system. So we have
Mhm.
400 nerves, 45 miles in length, and then the brain, the spinal cord, and the nerves. That's your nervous system. All of those nerves have a little bit of electricity in them all the time. When you step on the nail, it has not crossed this threshold to pain yet.
Mhm.
It's just on that danger neuron. So once you step on the nail, can we agree that your foot might be sore for a few days? Yeah.
Sure.
So it always takes longer for that alarm system to get back to baseline than it does to go off. And what I tell my kids, I'm like, you're really glad that you don't have to wait 3 days
Mhm.
to know that you have a nail in your foot or your hands on the hot stove.
Right.
Challenge we have is that 1 in 4 people in our country, and it's a similar statistic worldwide, the alarm never goes back down to baseline.
Mm.
So if your lower level is here and you're stuck here, we have so little wiggle room before we cross that threshold. Another great way to understand it is if you think about a house, and if you have an alarm on your house, we want that alarm to go off if someone throws a brick through the window, right?
Mhm. Right?
Beautiful. What if someone changes the sensitivity of the alarm and a leaf hits your window and the alarm goes off? Is your house okay?
Mm, yeah, I think that, it is. And I can see the correlation with how it can happen to us if we're in this high sensitive area. And by the way, I want to point out that I have noticed that when I am stressed, when I am whatever is going on, and I hurt myself in any way, I tend to feel that pain more so than ever. But when I really kind of bring myself to a calmer, more aware, more peaceful, present moment, then I'm better able to manage challenges and pain, specifically in that physical arena.
Would you like to understand why a little bit more?
Yes, please tell me why.
Okay. Um, so we're gonna finish this story, but then that's such a great segue into the next piece of it. Is so what I tell clients is, can your house be okay? And
Mhm.
your body is okay. You are feeling pain. All pain is real. We have never ever scanned fake pain. However, it's not the structures of the body or the house that we need to address. It is more the sensitivity of the nervous system. And
Mm,
so this helps people that have been in pain for a long, long time to start to understand how pain works. So this is going to lead in exactly to your idea around your experience around stress is why does some people's pain stay elevated and some other people it doesn't? Well, this has been studied and we call this yellow flags. And what yellow flags are things in our lives that can raise the sensitivity of the nervous system. And the closer we are to that threshold, the more likely we are to experience pain. One of those yellow flags is stress. It
mm,
is very common for people to have stressors and then experience more pain, whether or not they have acute pain. Our environment impacts our experience of pain. Imagine if you sprain your ankle on your honeymoon, the most glorious trip of your life, versus spraining your ankle in a job that you hate and where
mhm.
you're abused. It's going to be a different experience.
Right.
When we talk about people getting different explanations, oh, it's a ligament, it's a this, it's a that, it's a, it's a torn, you need surgery.
Mhm,
That in and of itself can raise the sensitivity of the alarm. Financial considerations, family considerations, all of these things can raise that alarm. So when you say, when you have more stress, it is more difficult for you when you have a painful experience, it completely makes sense. The
mhm.
physiology in a sentence is that when we have stress, we have a release of stress hormones, and stress hormones are inflammatory, and that inflammation can impact our experience of pain.
Yeah, brilliant, brilliant. As you were speaking, I was thinking about one of the experiences I've had this year. My mom fell, and which I have been dreading. She lives alone. She's 81. She's going to be 82 this year, and I hate that she lives alone. She lives in Atlanta. My sister's nearby, and I'm thankful for that. However, she fell in the middle of the night
Mm.
and was not near her phone and basically was on the floor for over 8 hours till my sister, thankfully, my sister had plans with her the next day. And my sister found her, but she broke her pelvis in 5 different places. And will tell you, this was one of the most challenging experiences that I've had in my life as a daughter, but definitely one of the most, I would say, meaningful experiences as a coach, as a mental fitness coach, as a tiny habits coach, because when I got there, there's nothing they could have done for her other than kind of give her something to numb a little bit of the pain. But she had a broken pelvis in 5 places. And she just did, the pain was excruciating. This happened on a Sunday when she was admitted to the hospital. I got there Sunday night. Monday, they wanted to have her stand up. And as being a physical therapist, that you need to get moving. And my mom was like, nope, absolutely not. She was not doing, and I remember I said, look, as the therapist, we're working with her. I said, look at me. We're going to do some breathing exercises. And I really walked her through kind of reminding her that, hey, this is what your body is trying to tell you. But I want you to just focus and giving her some of the coaching and every step of the way. Okay, you're going to put your hand here. That's all you're doing is putting your hand here. Okay, now put your other hand here. And now, all right, we're going to lift. And all of that, every single movement became one tiny step, right? And I really think that if it weren't for my training as a mental fitness coach in particular and a tiny habits coach, I would have not been able to support her in that way. And yes, it was incredibly painful for her, but really trying to keep her in lowering that stress so that she can begin to and my reminder to her was your mind is telling your body what to do. And you can have that power. And I don't know if that was the right thing, the wrong thing, but I'm so grateful that I had that opportunity to support her in that time.
That sounds like a tremendous gift and experience for both you and her. And what you did was you brought down her level of fear.
Mm,
And we know that
yeah.
pain is an output of the brain 100% of the time. It's also based on the level of real or perceived threat. And
Mhm.
so it makes sense that your mom's nervous system perceived a world of threat when
Right.
someone asked her to stand and they've told her she has five fractured in her pelvis because her world experiences and her knowledge is like a broken bone. We don't put weight on that. And
Right.
so that is a tremendous gift that you were able to give her. And it probably helped you too
Mhm.
to watch her as she endured this very difficult challenge.
Yeah, absolutely. And I think that this is the one thing that for ourselves, when we see other people in our lives suffering, we feel so helpless.
Yeah.
And then that definitely heightens our experience to be more overwhelmed or to be more stressed and can definitely send us into that danger zone where we're in fight or flight.
So people often feel helpless when it comes to
Mhm.
chronic pain. And people often feel helpless when they don't have strong level of mental fitness. And we know that that knowledge helps them and the awareness helps them. It's critical in both pain science and in the mental fitness world to understand how these things work so that we can do something with them and get the repetitions. Another super fun story about how pain and the PQ go well together is one of my somebody who went through the group with me. She is a kindergarten teacher, and so it was so powerful for her. And she was like, "When am I going to get these done during the day?" And she decided, you know what, I'm going to do them with my kids. So she has
Mhm.
so many good stories, but perhaps my favorite is she was doing these every day with her kids. And one day, a little girl fell on the playground and she broke her arm. And it was a very serious fracture in her upper arm. And it makes sense. The little girl was scared and crying, waiting for mom with the teacher and the principal. And the principal is trying to get her to breathe and help her calm down. And it wasn't working. So the teacher said, "Let's do our PQ exercises." She has a fun name for them, but I don't remember. And the little girl started doing the exercises with the teacher. And very quickly, she stopped crying. She was calm. She was interacting with the teacher. And the principal leaned over and said, "What are you doing to her?" And the answer was mental fitness exercises that I'm learning in the course. So it's very powerful.
Amazing. And as a mental fitness coach, I have seen the difference as well. But for you, you really incorporate this into your modalities, into what you're doing. What led you to kind of take this path into pain management and using mental fitness after being in the physical therapy world for so long?
I never did well with chronic pain patients. I remember a few in my very first job. And, it's hard not to be able to have tools to help people.
Mhm.
And then it was around 2014 or 2015, I started doing some self study in the area of pain. And then this opportunity came up for a 6-month certification. And I thought, I am all in. And I cannot count the number of jaw drop moments there were
Mm.
because we have been doing pain wrong for 3.5 centuries. And so then shortly after that, they opened up the fellowship. So then I did another year and a half, 2-year deeper dive into pain science. And it is just such an amazing complement to the skills I already had. We are never really replacing things, we're just adding in the pain science. And then the mental fitness, that was just by chance, and I was a little skeptical at first, and then there was this video to watch, and in the video, a big premise in coaching is tapping into the person's own expertise, which I am a fan. However, I cannot tap into somebody's expertise about pain until they first understand pain. So what Shirzad said, he's like, "Yes, that's important. We need to tap into the client's own best expertise. However, we first need to educate them
Yeah.
about the saboteurs. We need to educate them about pain." And as soon as he said that, I was like, that's it. As
You're
much as
in.
there is to learn, I am going to learn. So that's
I
my path.
love it. I love it. I want to come back to and talk about saboteurs, but there's something that you said, and I think that this is something that would be really great for the listeners to hear. How do we do pain wrong? What do we do that makes it wrong? And how should we be showing up in a better way so that we can better manage our pain?
We want to get curious about our beliefs about what pain is. And I will often ask my clients, so what is the definition of pain? And it's very easy for them to tell me what pain feels like and what their experiences are, yet they don't know how to define it. How would you define pain?
So for me, the pain is definitely that numbing or that thing that distracts me or takes me into being outside of my whole self into focusing into something so um specific within my body, within a moment, and it distracts me from being able to be aware of a lot of other things, right? And I think that that's and I've had a couple instances in the last year in which I experienced a lot of pain for different reasons physically. But it really, having been a mental fitness coach, allowed me to get a little more curious and not rely on medication as I would have in the past, right? And
Mhm.
just really kind of managing that and in moving through it better than I would have before.
Yeah. I think you've mentioned twice the physical side of pain.
Mhm.
And this is one of the things that we learned undoubtedly when we started being able to integrate these different scans in the 90s is that all pain has both a physical and an emotional
Mhm.
component. And
Mhm.
so, no matter what you're experiencing, you cut your finger slicing open a bagel, there is an emotional aspect to that, to even, any type of pain. So, the definition, I usually use a combination of three different key definitions, one from the International Association for the Study of Pain. That's a mouthful. And
That's
then a
awesome.
few other key pain leaders. So, pain is always an output from the brain. The brain always decides 100% of the time whether or not you will experience pain. And it is based on the level of real or perceived threat. And
Mm.
so, a real threat, you put your hand on a hot stove. A perceived threat, you put your hand on the countertop that is warm because the sun was shining there. Depending on your situation and the yellow flags, you
Mhm.
may or may not have that set off the alarm. And so, for people that are experiencing long-standing pain, we have to dig deep with them to figure out what is keeping the sensitivity up and what are the strategies that are going to work best to bring their sensitivity down. So that is broadly what pain is. So
Ooh.
how do we do it wrong? By chasing a physical structure. So people often think that pain must mean something is wrong with the tissues.
Mhm.
However, most of us, some of us, get a stomach ache or we get a little woozy feeling if we have a big presentation. So we actually have pain in our stomach, yet there's nothing wrong with our stomach. It is from the stress and anxiety of the presentation. The opposite is also true. Have you ever had a scratch or a bruise on your body and you didn't know where it came from?
Absolutely, all the time.
That is tissue damage, but your brain didn't care, so
Right.
you didn't have the experience of pain. So the ability to understand that pain and tissue damage do not go together. Another
Mm.
common mistake is I do not like the phrase no pain, no gain, because a lot of times people just blast through their pain. They're like, nope,
Ah,
I can do this. And they go, go, go. The unfortunate effect of that is your brain is giving you information. And if you
right.
keep ignoring it, it's going to keep giving you more and more information in
Mhm.
the experience of pain. So that is one extreme. The opposite extreme is many people think I cannot do anything until I have zero pain.
Mm.
And the physiology behind that is our nerves require 25% of our blood, even though our nervous system only weighs 2 to 3% of our body weight. So
Wow.
that blood flow and movement is absolutely critical. So
Mhm.
finding that beautiful balance between movement and not blasting through,
Mhm.
this can help people start to do pain in a different, more successful way.
Amazing. And I remember when I had a hysterectomy in 2018, a lot of people said, "Oh my God, you're going to be out. It's going to be incredibly painful." And I kept reading everybody else's experiences. And then I stopped and I said, "No, I got to do this differently." And I knew that it meant I needed to move, number one, and that there was going to be discomfort in the movement. But I also needed to take my temperature. Like, is this too much or is this what I need to kind of move through and push myself through a little bit? Because there's going to be that discomfort. And I will tell you, it, I, I don't really even remember like necessarily that it was the excruciating pain that people would describe. Number one. Number two, by the time I had my first doctor's appointment follow up, he cleared me to start doing basic yoga because I'd started walking and moving. And that was my goal, that I was not going to not move as I was coming home from the hospital, et cetera. So it definitely proved to me that we can really create the experience we want and by the awareness we have.
Mhm. Yes, and in pain neuroscience education, the best combination is movement and the education. So
Mhm.
much research to support
Yep.
that. We also have something called the PNE Plus program, which is 22 additional evidence-based researched options to help people reduce pain. Yoga is one of them,
Mhm.
nutrition, laughter, even prayer. So when
Yeah.
you told the story about your grandmother, we actually have research that supports how prayer can reduce pain. So there's so many ways that we can help a person if we are able to
Mm.
meet them and get curious about what it is that they're drawn to do. It doesn't really matter what works for me or what works for you. It's only about what works for the person in front of us.
Yeah, so good. I know that I said I was going to ask you about saboteurs. What are your top saboteurs? Because know my listeners hear me talk about them all the time. Mine is the hyperachiever and also the restless saboteur, but I'd love to hear what yours are.
My top saboteurs are pleaser and a mix of controller, which is a little bit of
Mm.
a weird mix. I've come a far, far way with reining in my saboteurs, but it is interesting
Yep.
because I was with all of my kids for Christmas, and it's been a while since we were all together. And then there were a few little incidents, and I was like, whoa, that's what that feels like. So we haven't
Yeah.
spent a week together since I've done positive intelligence. I was like, I don't miss that feeling at all. So yeah, those are my top saboteurs. And
Oh, it's so
we
good.
haven't actually gotten back to what happens in the brain with phantom
Yes.
pain. Should we
I
get back
think,
to that?
yeah, let's get back to that. I definitely want
Okay.
to close that loop.
This is one of my favorite, most powerful concepts in the world of pain science is we actually have maps in our brain, and I will show them to my clients because it's a funny looking man and it's called a homunculus. We actually have many of them, but we usually talk about the sensory homunculus. And what it is a Latin word that means funny little man.
Mhm.
And these were first, I think, drawn in 1937, so accurate, whichever physician it was, that they really haven't changed much. Here we
Mm.
are in 2024. And so, what it is when you step on that nail, and remember, it goes to a neuron in the spinal cord, then it goes up to the brain. Well,
Yep.
it goes to the left foot part of your homunculus. And so then you know you've done something in your left foot. The
Right.
challenge that we have is that when we have prolonged pain, significant stress, other physiological things going on, sometimes those maps become blurry. So then the
Mm.
brain doesn't know what to do. And so it might start knocking on the door. Is that an ankle? Is that a knee? Is that the right side? Is that the left side? And so this can help people understand the experience of spreading pain. It's like, oh no, now I have arthritis in my knee. Oh no, I have a torn labrum. No, we really have this concept of blurring maps. and the experience of spreading pain, and we actually call them nosy neighbors.
Mm.
In the case of someone with an amputation, the brain map is still there. That
Yeah.
brain map is biologically coded, it's there. And when the foot is no longer there, they're no longer getting blood flow and movement. So that
Mhm.
part of the brain can become blurry, or that can lead to the sensitization or the experience of phantom pain. So there are exercises we do to
Mhm.
clear those brain maps, and they are really powerful and really kind of fun for clients. There's all different things we do. But I like to tell this one research study, I can't quote the name of it, but they looked at these brain maps with musicians. They were able to look at the brain maps of the musician and say, you play flute, you play the drums, you play guitar, because the best way to have healthy brain maps is through exercise and movement. So if you are a drummer, your fingers are going to be different than somebody who's a guitar player. Their
Right.
thumb is probably going to be huge. So
Mhm.
that's a little bit about the brain map. So I love doing that work as well.
That's very cool. I love it. And, there's so many different things that we can unpack when it comes to what you do. I think that it's so needed to be able to have educators and individuals by our side that can really walk us through the emotion, but also the physicality that comes with healing. How do people find you and how do people work with you, Jen?
Yeah, my email is jen@iriseforme.com, all spelled
Ooh,
out. And that
great
is a great
website
way.
name, by the way.
Thank you. And then I have another website for the physical therapy, which is 180therapyandwellness.com, all spelled out. And there are contact pages that you can reach me in that manner. And I'm also on LinkedIn and Instagram. I can send you that information. I can work with people in different ways. So some of the more traditional physical therapy is one-on-one in person. There are many things we can do in lifestyle medicine and the pain science that can be done virtually. One really powerful area of pain science is pre-operative pain science, where I spend 30 to 40 minutes with somebody a week or two before a surgery. And we have super cool research that shows these people recover faster. They have less pain and they have more function. So that's a really interesting way that we can integrate the pain science as well. I am doing the mental fitness coaching. I do groups of that. I'm also integrating it into the physical therapy, and they all just kind of blend now. What
Yeah.
I use ebbs and flows depending on what the client needs.
Amazing. I am going to have all your information in the show notes because I do believe that there are several people listening to this and they really are intrigued or can can leverage and need your services. So we're going to have that information there. I have loved talking to you. Our time has been flying by. Again, I could
Yes.
probably keep you for another hour, but I won't. I want to be sensitive of your time. It has been great. Jen, will you come back?
I would love to come back
Yeah,
because I am very passionate about helping people help themselves. And that
amazing.
has been what I've said since I graduated PT school in 1990.
And you keep doing that. And thank you so much for living in that purpose and for helping others navigate these circumstances in life that may come up, that they need that support system. So make sure that you connect with Jen, that you give her some Instagram, LinkedIn love, and let her know that you found her through the Cost of the Confidence podcast. And definitely share this episode for other people who are looking for the right solution, support, and just education when it comes to pain. Thank you for listening, everybody. And Jen, don't forget, go confidently in the direction of your dreams.
Beautiful. Love it. And thank you.